We've created this report because the UK private healthcare sector is facing some very strong challenges, especially over the last 10 years when there hasn't been that much growth. And we see that there's a great opportunity in the future for growth in private healthcare in the UK and a return to growth in subscribers and a return to growth in people taking out private healthcare. The CMA has pointed out that we have got issues in the private healthcare sector around quality, around transparency and around affordability. And this report, The Prescription for Growth, points at how we can grow using those three factors. Customers are fundamentally asking for a much more customer-centred approach to private healthcare. And particularly if you look at Gen X, the younger generations, they're asking for much greater affordability, much greater transparency, something that's more relevant to them. The Prescription for Growth report has found that there is a possibility to have a projection of private healthcare in the UK to 5.8 billion revenue per year. That's an increase of 2.2 billion over where we are at the moment. The next steps for us are to unite around a vision for growth, and in that what we need to do is to bring together people in the private healthcare, hospitals, doctors, insurers, everybody involved in private healthcare to look at how we reform along the lines of transparency, quality and greater value for money to attract more people into private healthcare. The impact on the UK from the growth in private healthcare could be an improvement in health in the workforce. It'll be greater affordability and accessibility to private healthcare, and also it'll reduce expenditure on the NHS by £1.1 billion.